Hi, and welcome today. I'd like to introduce back Emily Brown from the PAF Foundation. Emily, if you want to tell everyone a little bit about what your organization does, and we are going to talk today about navigating through the insurance portal and everything that's involved in that. So, Emily.
Absolutely. I'll go ahead and share my screen and we can get going with the presentation. Well, again, thank you for having us, Jill. We're Patient Advocate Foundation is so glad to be partnering with you on this mini series of informational presentations. So a little bit about myself. As Jill said, my name is Emily Brown. I'm the Patient Education Content and Project Manager with Patient Advocate Foundation. I have been with PAF for over 9 years, and I'm just really happy to be talking to you today about health insurance open enrollment. So a little bit about PAF. Patient Advocate Foundation started in 1996 with a volunteer staff of 2, and we served 150 patients that first year. And now 25 years later, we have a full-time staff of over 200 employees. We've directly assisted over 1.7 million patients. Our foundation was started by Nancy Davenport Ennis and her husband, Jack Ennis, in honor of their dear friend and breast cancer patient, Cheryl Grimmel. They were inspired to advocate for patients after Cheryl experienced hurdle after hurdle while trying to access care for her breast cancer in the 90s. And after she was halfway through her treatment, halfway through a bone marrow transplant, they found out that her insurance company was not going to cover any of it. And they were devastated, and they just felt, Nancy and Jack felt like they didn't want any patient to go through what Cheryl was experiencing, fighting for her life, as well as fighting her insurance company at the same time. So on the night of Cheryl's funeral, Nancy and Jack wrote the business plan for Patient Advocate Foundation, and the rest is history. So a little quick breakdown of our different areas of engagement and the services that we provide to patients. We assist in a multitude of ways, and our case management services are provided at no cost to the patient or a point of contact that we might be working with. It's not necessarily the patient. We could be working with your doctor, with your spouse, or with a parent. Patients who come to us are able to have any insurance status, can be any age, can be any gender. There's no issues about ethnicity or cultural heritage. There's no issues about employment status. Really anybody, as long as they live in any state in the US or in a territory, can get services from us. There's no income guidelines. So as long as you are screening for or diagnosed with a chronic or debilitating disease, you are eligible to get help from us. So last year alone, we served patients with almost 750 different diagnoses, including 330 rare diseases. So another one of our big areas of engagement, or how we help patients, is through our copay relief program. It assists patients with diagnosis-specific funding to pay for copayments. And when funding is available, we do offer copayment assistance for acromegaly. Through our financial aid funds, we administer small grants directly to patients to help them with non-medical expenses like transportation, housing, food. That is also diagnosis-based assistance. Patient Advocate Foundation's educational initiatives, which is the area that I work in, we provide actionable advice and guidance to patients, caregivers, and healthcare professionals on a range of topics in a variety of formats. So we have webinars, interactive trainings, written publications, podcasts, animation, and more. We also offer a Scholarship for Survivors program that grants scholarships to patients who have been treated for a life-threatening diagnosis in the last 5 years. And undergraduate as well as graduate patients are eligible to apply for that scholarship. So now you know a little bit about us. We're going to talk this afternoon about open enrollment, some basics of the health insurance marketplace, special enrollment situations, cost saving, and some premium tax credits, how you're going to save money in the marketplace, how to pick a plan, as well as some tips and considerations that acromegaly patients need to consider during open enrollment. What is open enrollment? It's a term that you probably have heard a lot. It is the time each year when you can shop for insurance, simply. So you can buy insurance for the first time if you've never had it. You can opt to continue with your same plan that you've previously had, or you can switch it up and purchase a completely new plan. Open enrollment periods vary in length, so they can be as short as 2 weeks, and some even a few months long. The changes that you make during open enrollment go into effect the next plan year. So it's not immediate. It's going to be a little while, usually a month or so before those changes go into effect. As well, open enrollment dates don't always line up with the calendar year. So keep that in mind while you're looking at open enrollment as well. Since the choices you make during this time are going to determine your next 12 months of coverage, you want to make sure that you're being thorough and taking your time to really research and look at all the options that are available to you, just like you would with another big purchase. So if you were buying a new television, you would take time to look at your options, evaluate your choices based on your budget, how much you want to spend. You'd look at all the TVs in the store and weigh the features of the TV, the screen size, how it fits in your entertainment center. So this is the kind of thoughtful approach that you should be taking when you purchase insurance, because the plan selection that you make, excuse me, the plan selection you make is going to determine how much per month you're paying for premiums, as well as any other costs like co-pays, co-insurance, and deductibles. And your choices also affect what medical providers you have access to, as well as what medications are covered. So some options as far as how you can get insurance. Each state has a marketplace website for its health insurance, also sometimes known as an exchange. State exchanges offer many different kinds of plans. They're all designed to meet your budget and your healthcare needs. And you'll find links to each state's marketplace or exchange at healthcare.gov. It's www.healthcare.gov. There are as well some potential money-saving options called premium tax credits available through the marketplace. We're going to be talking a lot more about the health insurance marketplace throughout this presentation, so you can learn more about how all that works. You also have the option to seek insurance through your employer or your spouse or domestic partner's employer-sponsored plan. Most employers that provide insurance to their employees pay a portion of the premium. So typically, that's going to be your least expensive option. And if you're under 26 years old and your parents are willing to carry you on their plan, that's also a viable option and a viable way to get coverage. If you're over 65, or if you've been diagnosed with certain medical conditions or have been determined by Social Security to be disabled, you may be eligible for federal insurance called Medicare. You can get more information about that program. It's medicare.gov. There is a whole presentation we did prior to this about Medicare and about Medicare open enrollment. So if you want more information as well, I'm sure that's available on, I believe, the YouTube channel for the acromegaly community. Medicaid is another viable option for a lot of people. It's a federally mandated state-run program for low-income folks, families, and children, pregnant women, elderly people, as well as other people with disabilities. If you're to be eligible for Medicaid, you have to meet a coverage category as well as income and asset requirements. So those first things I mentioned, like being pregnant is a covered category, being elderly is a covered category. So you have to meet one of those coverage categories as well as income and asset requirements, which are pretty limited. However, some states have expanded their Medicaid programs, meaning that they offer benefits to a larger number of people. They've offered them to a lot more folks versus how the program used to run. So if you have more questions about this, additional info can be found at medicaid.gov, medicaid.gov. And another option you may consider is to buy health insurance directly from a private insurance company, an online seller, or an agent or broker. And if you want to talk about options available through those outlets, you would want to contact insurers directly to get more information. If you do choose these options, you will not be eligible for those cost savings that I mentioned through the health insurance marketplace. Touching a little bit more on the health insurance marketplace, to be eligible to purchase insurance through this exchange, you have to live in the US, be a US citizen, or be lawfully present, and you cannot be incarcerated. If you're unable to enroll in a marketplace plan, if you have Medicare or TRICARE, you cannot enroll in a marketplace plan. And it's actually illegal for somebody to try to sell you a marketplace plan if you do have that kind of coverage. Dates and deadlines are very important when it comes to open enrollment. So you need to make sure that you're completing your paperwork and getting your application in before the open enrollment period closes. The marketplace opens November 1st and enrollment ends January 15th. December 31st is when your coverage for that year ends. So if you already had coverage through the health insurance marketplace, it's going to end December 31st. And January 1 starts your new coverage. Dates for other types of insurance open enrollment varies. You can make changes to your Medicare plan from October 15th to December 7th. And if you get insurance through your job, those dates are going to depend on your employer. It's best to contact your human resources department for a little bit more information on the dates and kind of how that process works within your company. If you miss open enrollment for health insurance, there may still be a way to enroll in benefits if you have a major life change happen. This is true as well for employer plans, as well as the marketplace and many other sources of insurance. However, the changes to your plan have to be requested as soon as possible after the event takes place. Often you have to sign up for or change coverage within 60 days of the qualifying life event. So for example, if you get married or divorced, if you give birth to a baby or adopt a baby, if you lose your employer coverage or start a new position, a new job, if you turn 26 and you age out of being eligible for your parents' plan, if you become a US citizen, if you get out of jail or prison, or you lose your eligibility for your state's Medicaid or CHIP program, which is Medicaid for children, you may have the option to apply for new coverage so that you don't have a lapse. If you choose to voluntarily drop your coverage, or if you just decide that you don't want to have insurance anymore, or you can't pay your premiums anymore, that's effectively going to cause you to lose your insurance. However, if it's a voluntary change, you're not going to be eligible for a special enrollment period. If you do end up getting coverage through a special enrollment period, you may end up only having coverage for part of the year with that plan, and then you'll need to participate in open enrollment again for the following plan year. So for example, if you get coverage through a special enrollment period and it starts in February, and then the open enrollment for your company, say, starts in June, you will have coverage from February to June. And then at that open enrollment period, which probably happens before the plan becomes effective, so April or May, you'll have the opportunity to evaluate your plan options again for the next plan year for the coverage that starts in June. And before we go too much further, I'd like to go through some common health insurance terms so that we kind of all understand the language and the terms that I'm using. Even if you know these already, which you probably are familiar, sometimes it's just good to get a little refresher. So the health insurance premium is the amount that you pay to keep your health insurance benefits active. Most of the time, these are paid monthly. If you are on an employer-sponsored plan, they're probably going to come out of your paycheck. A deductible is the amount that you pay for covered medical services you receive before your health insurance plan starts to pay. And during this time, you're going to pay 100% of the contracted rate for the care that you receive. So this doesn't necessarily mean that you're paying the full retail price of the healthcare services you're receiving. By having insurance, your costs are automatically going to be lower. The rate that the health insurance company negotiates with your doctor is what is going to lower those costs. So even though you're responsible for 100% of the cost of your medical services before you meet your deductible, you still benefit from the lower rate just by simply having insurance. So for example, say you're rolling over to a new plan year and you need to have blood work at your endocrinologist. The retail cost of that blood work could be $500, but before you bought your plan, your insurance company negotiated with the office and the lab and agreed that the cost of the lab work under your plan is going to be $250. So that $250 becomes what's called the allowed amount. So although the retail cost is actually $500, that negotiation happened before you got your plan. And because of that, it means you're only going to be responsible for that allowed amount of $250 for that service while you're meeting your deductible. A copayment is a fixed amount you are going to pay for a healthcare service. For example, if you pay $25 to see your primary care physician, you're going to pay that every time you go to the doctor. A coinsurance is the percentage of covered services that you're responsible for after you meet your deductible. So in some instances, you will pay a portion or percentage for a service versus the standard fee. So as above with the deductible, you will still be paying a percentage of the allowed amount. So let's say your deductible is $1,500 and you pay that much, you meet your deductible. So when you go to the doctor, instead of paying that whole cost, you and your plan share that cost. So your plan pays 70% of the $250, and then the 30% is what you're responsible for through your coinsurance. An out-of-pocket maximum is the most that you will ever have to pay under your plan for cover services that year. So after you spend your amount for your deductibles, your co-payments, your coinsurance, all of that gets added together. And then at that point, your health plan will pay 100% of the cost for your covered benefits at that point. So let's say that your plan has a $1,500 deductible and you have a $2,500 out-of-pocket maximum. So your out-of-pocket maximum is always going to be more than your deductible. You pay your $1,500 deductible, and then you pay your coinsurance and your co-payments until you meet that $2,500 out-of-pocket maximum. At that point, once you meet that, you will not be responsible for any other charges for in-network covered care besides paying for your premium. Just a few more terms. Out-of-pocket costs are going to be those costs that we just talked about. It's really an umbrella term that includes your deductible, your coinsurance, co-payments, plus any healthcare services that you receive that are not covered by your plan. The formulary is also called a drug list. It is a list of medications that are covered by your plan. Usually formularies are structured into tiers, and the tier that the medication falls into corresponds to how much you pay for that medication. A network is a group of doctors and other medical providers across different specialties that have a contract to provide healthcare services to members of a plan. So your network is going to include doctors, pharmacies, labs, hospitals, standalone health centers, basically anywhere you receive care, anywhere you go for care. A covered service is anything your insurance company has agreed that they will approve under your plan. So think of your health insurance as a contract between you and them. So you signed your contract in the beginning when you enrolled that says you'll pay your premium to keep your plan active. And then in the plan documents, your insurance company outlined what they consider to be approved services. So under that plan, what they will agree is payable. And excluded services are going to be anything outside of that contract. So anything your health insurance company has said that they will not pay for, it's not part of the care that they agreed to provide to you. A little bit more about the health insurance marketplace. Earlier I mentioned is also sometimes called the healthcare exchange. It is an online hub in every state that sells qualified health plans. So when the health insurance marketplace was being structured, states had the option to run their own exchanges. So some states did choose to do that. California runs its own exchange called Covered California. Maryland has the Maryland Health Connection. Many other states run their own exchanges as well. But other states chose for the federal government to run their marketplace. So you will see those plans on healthcare.gov. So if you go to healthcare.gov, you choose your state, If your state is not federally run, if it actually has its own exchange, you will be redirected to your state's exchange to shop for plans. What's nice is that the marketplace lays out all of your options and makes it really easy to compare plans one-to-one. And we'll go through an example later on so you can see just how easy it is to kind of get an idea of what your options are. All the insurance products offered in the marketplace are going to be broken down into 4 categories. So the plans will either be bronze, silver, gold, or platinum. And the bronze plans are most often going to be the cheapest in terms of the monthly premium you'll pay, but it is designed to only cover 60% or so of covered medical expenses up to that out-of-pocket maximum. The silver level plans will cover about 70% of covered medical expenses. Gold will cover 80%, and platinum plans will cover approximately 90% and above of covered medical services up to that out-of-pocket maximum. So as you can see, the amount of coverage increases as the plan increases, but generally so does the premium as well. So for all of these plans, as we discussed, after you reach your plan's established out-of-pocket maximum, all of those plans will pay 100% of the covered medical costs. The marketplace is the only place that you will find financial assistance to help you pay for insurance. So premium tax credits are available to individuals between 100% and 400% of the federal poverty level. Depending on your income and how much of your income you would spend on healthcare coverage, you may end up qualifying for one of these credits. As well, there are extra savings known as cost sharing assistance that's available to individuals who enroll in a silver level plan and have incomes at or below 250% of the federal poverty level. So your eligibility for financial assistance is determined when you apply and when you fill out your application during open enrollment. And they're going to be looking at your household size as well as your income, your household income. So not just yours, how much all the members in your household contribute to your household income. And once you complete your application, you should be informed about the amount that you would be eligible to receive, and you'll find that information out immediately. Unlike some other tax credits that are available, you don't have to wait until you file your taxes to get that assistance. The tax credit is actually provided as a payment to your insurance company. It's sent directly to them at the beginning of your coverage in an effort to reduce your monthly premium. The caveat to this is if your income increases drastically during the year, you may have to pay a portion of that credit back. So always be sure to let the marketplace know if you have any changes in your household income or size. When the Affordable Care Act was written, which the Affordable Care Act is what established the health insurance marketplace, it also established that all plans have to cover 10 essential health benefits for its members. And those are outpatient care, emergency care, hospitalization, maternity and newborn care, mental health services and substance abuse services, medication, rehab services, lab work, preventative and wellness care, as well as dental and vision for children. Essential health benefits provide a coverage baseline for all the plans. However, there are still many variations of health insurance plans depending on the type of plan, the deductible, the copay, out-of-pocket costs, as well as the network of providers. So you can find out the specifics about each plan by reviewing the summary of benefits and coverage on each plan's website. And your employer or the Affordable Care Act marketplace should also provide side-by-side comparisons of all the plans that are available for you to purchase. I'd like to quickly look at some different plan types. An HMO or a health maintenance organization has a limited provider network, no benefits if you leave your network, and if you need to see a referral, or excuse me, if you need to see a specialist, you need to get a referral. PPO has a much wider network with more freedom for you to choose what provider you want to go to, and you do not need a provider, you don't need a referral to see a specialist. It does offer out-of-network benefits, but most of the time you will pay more to go out-of-network than if you had stayed in network. An EPO or exclusive provider organization has a more limited provider network, but no referral is needed for specialists, and it does not offer out-of-network benefits. A point of service plan or POS plan sort of marries an HMO and a PPO together. You have a broader network of providers. However, you do still need a referral to see a specialist, and you do not have out-of-network benefits. So I just wanted to touch on those plans a little bit so we kind of know more about when we're looking, we know kind of what we're looking at. And when I say out of network benefits, I mean you don't have coverage through insurance for those services. So if you leave the network and to receive care, that is your choice, and that's fine to do so. But depending on the type of plan that you have, you'll most likely pay more or all of those charges. If you do not have out-of-network benefits, then you will be responsible generally for the full retail cost of the care that you get out of network, and you do not benefit from that contracted rate that was negotiated before you purchased a plan. As far as out-of-network situations are concerned, in these instances, they don't apply if it is emergency care that's being sought. So if you do have an emergency, you should always go to your closest hospital, no matter whether it's in network or not. But just make sure your insurance company knows as soon as possible if you do experience a true health emergency. And then after the fact, you're able to, kind of negotiate that. Usually your insurance company will still pay for that as long as it's a true emergency. There's another type of plan called a high deductible health plan that can actually be any type of plan. I know it's a little bit confusing, but it has a higher deductible and a higher out-of-pocket maximum than other plans. So it can still be an HMO or a POS or any of those types of plans. But they are attractive to a lot of people because they can be combined with a health savings account, or sometimes it's called an HSA. And it allows you to pay for medical expenses with money free from federal taxes. So if you have this type of plan through an employer, many times they're going to contribute to your health savings account as well, which gives you money to pay your medical expenses. I actually have this type of plan myself, and myself and my employer both contribute to the account. So when I have a medical bill, I use my HSA to pay that bill, and it doesn't come out of my pocket, so to say. There's a specific type as well of high deductible health plans available that's more of a worst case scenario type coverage. It has a low premium generally and a very high deductible. I wanted to mention it because it may be the best choice for somebody else in your family as you're shopping for coverage, but it's really not, in my opinion, ideal for someone dealing with acromegaly or anyone really who has a chronic or rare disease. But like I said, I did want to mention it just because it is an option. You can only purchase these plans if you're under 30 years old or qualify through a hardship exemption, meaning you have been in a situation that prevents you from being able to afford health coverage. They generally cite things like having been homeless. So if you meet one of those hardship exceptions, you can purchase a plan like this if you're over 30. But if you're shopping through the marketplace and are over 30, these plans generally won't even display for you as options. So like we discussed, when you're enrolling in a health insurance plan, you want to be doing your research ahead of time. You want to make sure you're looking at the premium, which again is the most outright cost that you'll feel in your pocket each month. You'll want to look at in-network providers. Again, that includes labs, hospitals, etc., wherever you receive care. You're going to want to look at deductibles. Some plans have a separate deductible for medical care as well as what you pay for your prescriptions. Others are combined. So that's something that you'll want to make sure that is something that you look at when you're trying to purchase a plan. As well, you'll want to look at the formulary, look for the medications you're taking, but also look at alternatives to your current medications. If down the line your doctor wants to switch your medication, you at that point will have a better idea of what and how the alternatives are covered. And this last one is one I think that people forget frequently. Look at the exclusions of your plan. So these are going to be explicitly listed. They will say what the plan outright will not cover or pay for. Generally, this is things like homeopathic services, cosmetic procedures, that kind of thing. But it's still a great thing to look at so you know kind of what isn't going to be covered. This is just a nice visual. We like to think about healthcare costs as an iceberg. So what people see is going to be the monthly premium. Like I said, that's kind of what you feel most, what's coming out of your pocket every month. But you need to remember as well that the total amount of your healthcare costs goes well beyond what you pay monthly for your premium. So there are costs under the water that a lot of people don't remember or think about when they're shopping for coverage. And a lot of times people are going to choose plans based on the premium alone. But sometimes the cheapest premium may ultimately mean that you're paying significantly more during the year for your care when you look at the cost of the deductible and other out-of-pocket expenses. And when we go through the example later, you'll see how clear that is. So when you sit down and look at your options, you want to make a list of the medical expenses you have had that you know you're going to continue to have, like specialist visits, prescriptions, whatever other treatment that you know you're going to have on an ongoing basis. Review your explanation of benefits, which these are statements that you get after every healthcare interaction that explains how your insurance paid their portion. You're going to want to really evaluate how much you paid for your healthcare over the last plan year. There are some really good options as far as how to track your healthcare expenses that are available online. You can really just look up healthcare expense tracker in Google or any your preferred search engine, and you'll be able to find some nice tracking sheets to kind of help you keep track of how much you're paying annually for your expenses. As well, look at how these costs relate to your current insurance and how your new insurance options fit within your current budget. Get all your paperwork together that you'll need for the application. We're going to talk about what you're going to need to apply in a second. And then you're going to want to be sure to submit this paperwork before the end of the open enrollment period. To enroll, you are going to need the names of all of the members in your household, including those who will be and those who won't be applying for coverage. That's going to be because they're taking the number of household members into account when they're calculating your subsidies or how much financial assistance you may be eligible for. The age, the date of birth, and the mailing address for everyone in your household is going to be needed to be provided. Social Security numbers for everyone, even if they are not applying for healthcare coverage. You will need to know your household income, and the parent is required, even the parent's income is required, even if the parent is not going to be applying for coverage. You'll need a list of current treatments and medication for each person enrolling. That's not necessary for the application, but it is going to be something that you'll want to have available so that you can help search. As well, you'll want your provider, facility, or pharmacy preferences available. Again, that's not part of the application per se, but you're going to want it in terms of your search and in terms of looking at your different options. So when you're ready to enroll, the nice thing is you have several options to enroll. You can apply online and complete the online application at healthcare.gov. If you're more comfortable over the phone, you can call the call center for the health insurance marketplace at 800-318-2596. You can get in-person help and work with people in your community trained to help you apply and enroll. If you visit healthcare.gov and do a zip code search to locate a person in your community, you can also go through an individual agent or broker, or you're able to complete a paper application that is available on healthcare.gov. Like I mentioned a little bit earlier, there are some cost saving opportunities within the health insurance marketplace. The first being the premium tax credit I mentioned earlier. It lowers your monthly premium. And you qualify if you earn at least 100% of the federal poverty level, but no more than 400% for your family size. If you're not sure about that, it does automatically calculate that on the application as well. If you just quickly Google federal poverty level calculator, you put in your income and you put in your household size, and it tells you what percentage of the federal poverty level your family falls into. You have to, as well, you have to enroll in a health insurance policy through the health insurance marketplace or your state's website to qualify for a tax credit, and you cannot be claimed as the dependent by anyone else. Another option for cost savings is subsidy eligibility, which helps with out-of-pocket costs. The eligibility for this assistance is a little bit stricter. Your household income needs to fall between 100 and 250% of the federal poverty level. You have to be a U.S. citizen or legal resident, and you cannot be incarcerated. You're not going to be eligible for any kind of premium subsidy if your employer offers affordable coverage, or you have access to affordable coverage under a family member's plan. For both of these, your cost for healthcare coverage cannot exceed 9.86 of your household income, 9.86% of your household income. If you earn less than 100% of the federal poverty level, or if you earn more than 400% of the poverty level, you aren't here legally in the US, or you're currently incarcerated, those are all other reasons that you would not be eligible for a subsidy. Let's get into actually looking at plan options. So before we begin, let's walk through a hypothetical situation so you can get an idea of how things work to purchase insurance through the marketplace. This right here is an optional step, but before you begin, there are calculators online that show you how much assistance you can expect to get, if any. And this is a great one available at the Kaiser Family Foundation website. It is kff.org/interactive/subsidy calculator. It's on here on the slide, and then the slides will be available to you as well. I use the example of a 30-year-old single woman in Virginia with an 8-year-old son, and they have a household income of $45,000 annually. I input that information into the calculator. It told us that we were likely eligible for financial help. And based on the information we provided, the income that we have is equal to 246% of the federal poverty level. So again, that makes us eligible for assistance through the marketplace. And it gives us an estimate of how much financial help we might be able to get. So this tells us that we may be eligible for $434 per month as a premium tax credit, which will cover about 75% of our monthly costs. If we choose a silver plan, we can expect to pay about $144 a month. And then the most we will pay for a silver plan is going to be about 3% of our income. And without financial help, we could expect to pay about $580 per month for the same plan. So now we have a little bit of a better idea of what we can expect to receive as far as financial assistance, and we can start our search on healthcare.gov and begin to look for plans. I use the same search criteria throughout. You see that the mother listed here is you. She is eligible for $439 a month, and the child will also be eligible for that same tax credit. So Kaiser, the Kaiser Family Foundation calculator that we previously used quoted us $434 a month. So this very closely lines up with that. Again, it's just an estimate, but that is very close, and that's really going to help out as far as the financial costs that we're going to incur for health insurance. So once you complete that, you can actually begin to search for plans. So I got our plans. I picked 3 at random. There were 22 plans available in our search. So for a 30-year-old single woman in Virginia with an 8-year-old with a household income of $45,000, there were 22 plans available to her. There were 9 bronze plans available. Still silver, there were 7, and 6 gold plans. No platinum plans actually showed up, but this is just a random zip code in Virginia. There are still tons of platinum plans that are being sold. It just didn't come up in this particular search. So you can see the estimated premium for this bronze plan is a little under $34 a month, but it has a $9,100 deductible. And a family deductible, so you and your son, is going to be $18,000. And then for your out-of-pocket maximum is going to be $9,100 and then an $18,200 out-of-pocket maximum. The estimate for the silver level plan is going to be about $138 a month. Remember, Kaiser quoted us $144, so very close in line, with a $5,700 individual deductible and an $11,000 family deductible. So you see that really, that family deductible really came down. It's going to be a $7,200 individual out-of-pocket maximum and a $14,400 family maximum. You can see here that it states this person's eligible for extra savings. So that's the cost sharing assistance that we discussed previously. The gold level plan is going to be about $183 a month with an $18,000 individual deductible, $1,800, excuse me, and a $5,400 family out-of-pocket deductible. The out-of-pocket maximum is $8,500 for an individual and $17,000 for the family. So you can see it's interesting here. The out-of-pocket maximum is higher with the gold plan than the silver. So once you have a plan that you want to learn more about, you can click into that plan and search for the summary of benefits, the provider network, the formulary, as well as view any kind of brochures or promotional materials about the plan. You can also see more of the costs that you may incur for different medical services, and you have the opportunity to put in your preferred doctors and medications to see how those are covered. It's really nice that through the marketplace, you have the option to view the plan side by side. I really do recommend doing that if you're shopping for coverage there. You do need to decide which plans are best for you and your family, which is going to be one of those plan types that we discussed before. Don't just look at the premium when you're kind of viewing your overall costs. Like we talked about, you may find that a higher premium, you're going to have a lower deductible, a lower out-of-pocket expenses. And while you may be able to pay a lower premium, but have a higher deductible and out-of-pocket max throughout the year. So you need to weigh what's going to be best for your budget. When you're searching, look at your preferred providers. That includes, again, your doctors, specialists, hospitals, pharmacies, and make sure that the routine care that you have includes medications. Other things you need to look at is how flexible the plan is, including referrals and how much out-of-network visits or costs are going to be covered. If you're eligible to receive any cost sharing through the marketplace, again, like I mentioned, be sure to update the marketplace to any change in your financial situation. If you have a big change in your income over the year, you need to report that to the marketplace and they may adjust your cost. If you don't report it and then file your taxes and you have a much higher income than you reported in the beginning, you will have to pay back the cost sharing that you received. So instead of getting yourself in that kind of sticky situation, it's probably best to just go ahead and report upfront. And being that it's likely that people in your family may have different health needs than you, everyone is eligible to enroll in different plans in the marketplace based on what their individual needs are. And if your situation changes and you lose insurance, be sure to look at all of your options for getting insurance and see which ones are going to be the best for your family and your budget. The health insurance marketplace might not be the best choice. It might be through your husband or your domestic partner's plan. You might even be eligible for Medicaid. So it's that, refer back to that listing that I mentioned in the beginning. You might be able to get comprehensive coverage through another option. So just real quick, some common misunderstandings. When the Affordable Care Act was first established, there was a mandate that said that you had to have insurance. There is no longer a mandate that you have to have health insurance. The penalty was eliminated around 2019. That being said, you do need to weigh the pros and cons of being uninsured. You're not going to be penalized on your taxes for not having insurance, but it is something that you really need to weigh if that's, a choice that you want to make. And if you miss open enrollment and you miss the deadline, that may mean that you're uninsured for the rest of the year unless you qualify for one of those special enrollment periods I discussed, or if you maybe start a new job that has employer-sponsored benefits. Once you chose your plan and you enroll, your insurance is not going to become effective until you submit both your application and your first month's premium payment. And once that happens, you can expect to get your insurance card and then any other plan documentation related to your plan in the mail. And lastly, once you've enrolled and everything is active, it's vital that you pay the monthly premium on time each month so that you can keep the coverage that you worked really hard to pick. So thank you for listening. I hope you learned a little bit more about how the open enrollment process works, and feel free to send any questions my way.
Thank you, Emily. What a great talk. I know that you are going to stay on and take some questions. I myself, I was hoping that you would go a little bit into the appeals process for patients. That's something that, patients with acromegaly have to face a lot, having to appeal. I myself, recently last year, 10 months ago, I had surgery. And I just got an EOB in the mail the other day that stated that they weren't going to pay the hospital because it had timed out. They waited too long to submit their bill. So I'm wondering who's going to have to pay that bill if my insurance is declining payment. And, it's a tough place for patients to be, especially when they're put in this position. And I know that it's stuff that you guys at the PAF Foundation deal with on a daily basis.
Absolutely.
And so I'd love for you to kind of hit on that, and then we'll take some other questions from people. And then after that, we'll hear a word from our sponsors.
Sounds great. I'll be sure to do that.
Okay. So Emily's going to answer our questions. And I did see where there was, she's going to answer the question that I posed. And then she is going to, I did see that we, in the chat, that we had, go ahead and answer mine if you can, Emily.
Sure. Okay, so I have a few slides to actually go through in terms of the appeals process. Once you purchase a plan, so like we talked about, you worked really hard to pick your plan, it's important that you know the rules and regulations of your plan. Appeals are a big part of that. So if you receive a denial, you might hear about it from your doctor or an insurance company, or maybe at the pharmacy counter. If you are having a denial for medication, you might even hear about it after the fact. So like in Jill's case, she's already had her surgery and now she's, potentially experiencing some denial issues. So you may get word, or you may hear about a denial on an EOB. So that's a document that's sent to you after you get your healthcare services. In these situations, you need to pay attention to how long you have to submit an appeal, and as well how you need to submit it. So it will tell you on the EOB or on the letter you get from your insurance company the deadline. Most initial denials have to be submitted within 6 months of the initial denial. Other plans only give you 90 days. So it's really important that when you first learn about the denial, you need to really make sure you adhere to those timeframes, count out the dates, do a date calculator online, make sure you know exactly when you need to have your appeal in, because if you miss it, you lose your chance. Based on the way that your plan is structured, you may have several levels of appeal available to you. As well, you may be able to request an urgent appeal, meaning that it's going to be 72 hours for your insurance company to make a decision. Generally, like I mentioned, you will get some type of written notification if you are receiving a denial. This is called a denial letter, and they, as I mentioned, have to provide written instructions on how you need to appeal, the timeframes to appeal, as well as where and how to send your appeal. There are times when you may feel like you have a denial when it's not actually the case. So there are situations where sometimes if you have not yet reached your deductible and your insurance isn't covering your care, then you have large co-payments, large co-insurance components. That's going to feel like, oh my gosh, I owe so much. My insurance must not be paying anything. But that's not actually a denial. There's no appeals process for that period where you're reaching your deductible. If you do get a denial, the first thing you should do is call your insurance company. There might be an easy fix. Sometimes it's as easy as just missing documentation. There might be a billing issue that resulted in the denial. Sometimes it's as simple as your birth date was typed in incorrectly, or they transposed your social security number, and then your insurance company rejected the claim. A quick note as well on calling an insurance company, my recommendation is to take very, very good notes. I recommend that you write down the date and the time of the call, who you spoke with, the details of the conversation, and then if there's anything that you need to do to follow up, that way you have something to reference back. In addition, you should also reach out to your doctor. Your doctor may be willing to write an appeal on your behalf and submit it to the insurance company since they're the one that prescribed the care in the first place. If your denial isn't able to be resolved with just a phone call to your insurer, then you need to go ahead and try to get organized, get that denial letter or EOB together with your medical records, and get ready to write your letter. So the first thing you need to do in order to write an effective appeal letter is to make sure you understand why you were denied. The documentation for why you were denied is going to be on your EOB or on your denial letter. They must give you the specific reason. And anything that you write in your letter needs to directly address the denial reason. So if they're denying you because they say the care that you got was experimental, then you need to only be addressing experimental as the reason for that denial. And any extra information that you include, they're going to ignore. It's going to be considered irrelevant. So connect with your provider's office, check to make sure that or just check to see if they plan to appeal for you. If they are not going to submit the appeal on your behalf to the insurance company, ask if you can get suggestions of medical journals or peer-reviewed articles that can help support why you needed the care that you received. As well, you should request a letter of medical necessity from your provider to include with your appeal. And that letter is really just going to be basically your provider's rationale, why they ordered the care that was denied, why you needed it, why it was important for your care plan, as well as how your medical situation impacts your life and why it's important for you to have gotten the care that you did. So receiving a denial is obviously a very emotional situation. It's frustrating. You can, it can be scary to be potentially stuck with a large bill. So just try to, when you're writing your letter, avoid being angry or really emotional, and just try and remember that this is a business decision for the insurance company, and they're making their decision based on the contract that you have with them. That doesn't mean that your insurance company necessarily is out to get you or anything like that, or they're against you. They may even offer advocates or other resources to help you through the appeals process. The most important part of your letter is going to be why you were denied, as we talked about, how it affects you, and why you should be able to get the care that you need. And you really need to talk about why it affects you. So if you got a medication that was denied, what was that medication going to help with? So you really need to address that specifically. And when you're done writing your letter, submit it along with your doctor's statement, your denial letter from the insurance company or the EOB, and then any medical evidence or medical records that support your need to get that care, and make sure you send it on time the way that the denial letter requested. So you might need to fax it, you might need to submit it through your patient or your insurance portal, or sometimes they want it by mail. And lastly, you should get a notice about 10 days after you send your appeal that it was received. If you don't get any kind of confirmation, just give them a quick call to check and see, make sure it got to the right place. The timeline for a decision depends on what type of appeal you submitted, which level of appeal you're on, and a lot of other factors throughout the appeals process. You may even hear back in as little as 72 hours, but standard ones typically take like 45 or 60 days. The answer for your appeal may be provided via phone, but they will always send a letter as well. They'll always include a written response. And if you receive a second level denial, there'll be instructions on how to continue the process and next steps. So I know this was just a quick overview. It's really high level, but PAF actually has a 9-module appeal series for free. You can view at patientadvocate.org/education, and it goes really into detail and offers a lot of additional information that might be helpful.
So in my case, I received no denial letter. It was just on an EOB. They paid everyone else for that date of service, but the hospital, and it was a $60,000 bill.
Yeah.
And so I'm concerned.
Understandably so. I mean, it's frustrating, it's scary. You don't want to be stuck with that, obviously. I mean, that would be hard for anybody to pay. So
And I went even prior to the surgery to make sure that they were in my network, making sure that I was following all the rules. And whenever I had the surgery, I actually paid the hospital my portion up to my out-of-pocket maximum. And so it makes no sense to me why they're not covering, that out of all of the others, and especially the excuse that they gave that, they had sent them the bill too late. So I will be, I guess, contacting the hospital to see what they're doing about it, and then contacting my insurance. So we have another question. How do we get help with getting our insurance to possibly pay for other medications that we need? How do we get insurance companies to cover our condition and the high cost medications included? I know that a lot of our medications, we have to have a pre-authorization. They have to go through a pre-authorization process.
absolutely.
I need to get info on how to contact someone directly to help me with her issues. And I can't use healthcare.gov programs as she travels all over the US for her job.
Okay.
And so it's impossible to use a local network.
Sure. So, okay, that was a lot of questions. I'm going to go back to the beginning. I think the first question was, where can I get help with medication?
How do we get help with getting our insurance to possibly pay for other medications that we need?
Okay, so there is something that's called a formulary exception. So if there's a medication that's needed that is not part of the drug list that's, provided with your insurance company, you may be able to get an exception. It is similar to the appeals process. It's a little less formal, and typically you get a decision a lot quicker. But I would recommend reaching out to your doctor or your wife's doctor to ask about a formulary exception if it is a medication that's not covered by your plan. In that case, how that medication is typically paid for is it would fall onto the tier. I believe we talked about tiers in this presentation. It would fall onto the tier where the alternative drugs fall into. So if there's a medication that's comparable to the one that's not being covered, but that medication doesn't work for you and you really need the one that's off the formulary, you would, if the formulary exception is approved, then you would pay a similar price to the medication that is on the formulary. Okay, so what was the second one? You lost me there.
And how do we get insurance companies to cover our condition and the high cost medications included? That's kind of the same thing.
Yeah, the formal appeals process, if it's, it depends on what type of medication it is. If it's a specialty medication, that's handled a little bit differently. But normally I would recommend speaking with your provider to see if they can back you up on trying to get a formulary exception.
I also recommend, if there's a particular medication, go through the drug company's patient assistance programs. They will help with the pre-authorizations. They will give you a low copay. If you use their service, I know a lot of ours are $5 or $0 copays. Those the individuals that work for those programs are there to work for us to try to make that process as easy as possible.
Absolutely. That's a great point. And a lot of times they will, like you mentioned, they'll help the pharmaceutical companies. They have case manager type roles that will help with pre-approvals, will help with prior authorizations. And then a lot of times those programs, if your insurance company at the end of the day says, absolutely not, we're not paying for this, even if you have insurance and they don't cover it, a lot of times they will, sometimes offer free medication to you, or, just provide that to you and you don't have any kind of copayment or anything like that. It's kind of off insurance.
And what do you recommend to someone that's traveling throughout the country and they can't use?
I would recommend reaching or trying to search for a PPO plan. So that's the one that has the widest network. So if it is a situation where you're kind of bopping all over the country, you aren't in one place for too long, that's going to be the kind of plan that is going to offer the most flexibility in terms of provider network. So you're going to get you're going to get a lot more options as far as where you can go. And as well, those plans do offer out-of-network benefits. So you might pay a little bit more if the provider you see is not in the network, but you are still going to have some type of coverage. So you're not going to be stuck with the full retail cost at the end of the day.
Okay. I want to remind everyone that they do have online help at the PAF Foundation. If you have any questions in the future, don't hesitate to contact them. And, I want to thank you for your help with this series, Emily. And I hope that you all stay on for a word from our sponsor. Thank you so much.
Thanks for having us.
Pharma. Thank you for taking the time to attend the Acromegaly Community Insurance Education webinar. AMRIT Pharma is proud to sponsor this event in order to enhance the community's understanding of how best to navigate insurance basics and overcome potential barriers to care. Over the last few years, the complexity of accessing medicines has only increased, placing additional burdens on healthcare professionals and patients to effectively navigate the system to get the medicines they need. Since 2016, AMRIT Pharma has been serving rare disease patients around the world and has delivered an oral treatment for acromegaly to patients in the US since 2021. With an exclusive focus in rare diseases, we are able to provide a comprehensive and personalized approach to everything we do. Whether that's the basics of navigating prior authorization and financial assistance, or ensuring that each patient receives their medication in advance of a natural disaster, we are here to help. We know that living with acromegaly comes with both physical and emotional burdens, and we aim to make it easier for you to get the treatment that you need. We believe in open access for patients and their physicians to decide what therapy is best suited for their individual situation. We hope that you've taken away knowledge during this session that will better prepare you for open enrollment in the coming weeks and will allow you to navigate barriers in coverage and access as they arise. You can learn more about Amrit Pharma by visiting our website at www.amritpharma.com. Thank you.
Thank you again for joining us tonight. And, go out and live your best life. I will talk to you soon. Thanks.